Good evening. Welcome and thank you for joining us today as we provide an overview of the draft OPWDD 1915C Home and Community-Based Services Waiver Amendment. My name is James Kaufman, Deputy Director for the Division of Policy and Program Development. We are joined here today by leadership and staff from various divisions of OPWDD who will assist in going through this presentation. As Sarah noted, please note that a recording of this presentation will be posted on the OPWDD website as soon as it is available. The purpose of today's session is to review the draft OPWDD HCBS waiver amendment. We want to help stakeholders focus their review on the sections of the waiver that are most important to them. Where possible, we've noted specific page references throughout this presentation. We have the goal of achieving an October 1, 2023 CMS approval, and we are on track to do that. This time frame will allow with the expiration of Appendix K flexibility, which will end on November 11th. As we move throughout the presentation, we will introduce the major themes: permanent adoption of certain App K flexibilities, programmatic and fiscal changes. Overall, the changes in the amendment are intended to build on lessons learned during the pandemic and to improve the effectiveness of waiver services moving forward. Today's topics. The four main topics presented here today include: where can I find the waiver? There are multiple ways in which the waiver amendment can be viewed, including the OPWDD website and at any of the OPWDD regional offices. Public comment. This begins today and will end on May 12th. What is the waiver? Providing a description of the document and how it is organized. An overview of the changes which staff will walk you through. Where can I find the waiver? The draft October 1, 2023 waiver amendment is available on the OPWDD website at the address shown here. It's opwdd.ny.gov/providers/home-and-community-based-services-waiver. Hard copy of the waiver document and materials can be viewed at any of the 14 OPWDD regional offices. Also, if you do not have internet access, you can visit any of the county social services offices to view the document and materials online. Shown here is a list of all 14 OPWDD regional offices and their addresses. Public comment. As noted, the federal public notice has been published on the state register, and with this, the public comment period begins today, April 12th, and will end on May 12th. Between now and then, written comments can be submitted by mail to OPWDD at the address shown here, or to the People First waiver inbox. This address and email information is also located on the OPWDD HCBS waiver website, as are the waiver amendment documents and links to the federal public notice. Thank you again for your interest and participation in today's presentation. I will now hand over the presentation to Martha Barnhart.
Thank you, Jim. We're going to start with what is the waiver. The Home and Community-Based Services Waiver is an agreement with our federal partners at the Centers for Medicare and Medicaid Services, or CMS. The waiver is a collaboration between OPWDD and DOH. Department of Health administers the waiver, and OPWDD operates the waiver. Why do we have an amendment? Waivers are authorized by CMS for 5 years. The last waiver was renewed on October 1st of 2019. Anytime a waiver is changed or revised within those 5 years, it is considered an amendment to that agreement. Since the last renewal in 2019, there have been a number of revisions, the majority of which have been in response to the COVID-19 public health emergency. Its focus is on the permanent adoption of certain Appendix K flexibilities. These changes will continue to build upon the lessons learned during the pandemic and improve the effectiveness of waiver services moving forward. Our goal is for an October 1st, 2023 approval of the proposed amendment so that these updates can be in place prior to the anticipated end of the Appendix K coverage on November 11th of 2023. The following slides will provide a high-level overview of how the waiver is organized and the content of each section. There are various appendices that address the different obligations that OPWDD must follow. I will highlight the ones that would be most important to this amendment. Here for Appendix B, there are minor updates to service and language access. On this slide, I would like to call your attention to Appendix C, Participant Services, Service Descriptions, including service limits and provider qualifications that are on pages 58 to 166. This is where the majority of updates will be in this amendment. In Appendix G, there are a couple of updates in regards to promote and medication administration. Finally, in these last sections, Appendix I, Appendix J, and Addendum A address the fiscal elements of the waiver. We do not anticipate any changes to the Appendix J at this time. A quick review of what we've already discussed so far. We talked about what the waiver is, what an amendment is, and where it can be found, along with the specifics of the public comment period. Now we're going to shift our focus to the proposed changes. These will address some of the temporary flexibilities that are authorized by the approved Appendix K related to the public health emergency, in addition to programmatic, fiscal, quality, and administrative changes. As previously mentioned, we are asking CMS for approval effective October 1st, 2023. We don't expect to have approval prior to the end of September. It is important to remember that some of the proposed services are still in a conceptual phase. They will not be immediately available on October 1st. Once they are approved by CMS, we will work towards the development and implementation phases. Additional information will follow as it becomes available. The first update that we are going to review focuses on assistive technology, environmental modifications, and vehicle modifications. This is a return to prior practice. There are higher reimbursement caps that are in line with the cost of the recently approved projects and items. These hard limits mean that the waiver cannot pay more than these limits for any modifications or devices. For assistive technology, the cap is $25,000 in any consecutive 2-year period, and this includes a $5,000 cap for new home-enabling supports that we'll discuss next. For environmental modifications, there is a $60,000 cap for 5 years. For vehicle modifications, there is a $35,000 cap and $65,000 for complex modifications. For instance, modifications that would allow an individual who uses a wheelchair to drive the vehicle. These changes will support a more streamlined and efficient approval process. Any requests that are submitted prior to October 1st, 2023 will be subject to the existing limits. Additional information can be found on pages 108, 119, and 135, respectively. We'll discuss assistive technology a little bit more. This is an add-on to the current assistive technology service. It is not a new waiver service. The addition of home enabling supports will allow individuals to acquire smart home technology that will assist with increasing their independence within their own homes. This includes a $5,000 limit which is part of the total $25,000 for assistive technology in any consecutive 2-year period. Details on this can be found on pages 108, 109, and 358. There are additional efforts underway to review the existing process flow for vehicle modifications. We are envisioning a possible change that may allow for a more direct provision of services by approved providers. This would create a more user-friendly and accessible service, and this is highlighted on page 135. There is a modification to residential habilitation and respite services. Under the existing guidance, individuals in certified settings cannot participate in community respite programs. This change would allow individuals above the age of 60 who live in a certified setting to participate in a respite program for seniors that would take place outside of the residence. We hope that this change will address the longstanding desire for retirement options that would address the socialization and engagement needs outside of the home. For higher needs, there is a small descriptive change. This will expand the definition of a qualifying event, which includes, but is not limited to, accidents or events resulting in serious personal injury with hospital admission or substantial medical treatment, or intervention which results in a significant change of functioning. Details of these definitions, along with what constitutes a significant change, can be found on pages 77 and 78. As previously mentioned, we have had a number of temporary flexibilities under Appendix K related to COVID-19 public health emergency. In prior waiver amendments, there were a number of services identified as being able to be delivered remotely. With this amendment, we are seeking to extend the remote delivery option to family education and training in order to be consistent with the recent waiver amendments. And details for the remote delivery of these services can be found on pages 121 and 122. Currently, there is an individual-directed goods and services chart, and it is located in the waiver and available on the OPWDD website with the Administrative Directive Memorandum 2015-ADM-05R. With this amendment, we are seeking to remove the IDGS chart from the waiver. This would provide more timely updates by allowing changes to be made effective with updates to the administrative memorandum. Changes to these ADMs are subject to stakeholder review and comment prior to authorization. There are some minor technical updates included as well. The information that currently exists in Appendix C2C is moved to Appendix C5 per CMS's direction. There is not a great deal of content changes. This is simply a relocation of information. It is anticipated that Section C2C will no longer be an active section of the waiver application. Additionally, throughout the document, you will see added references to Parts 625 and 636 to ensure proper and consistent citations of current regulations, and these are primarily in Appendix C. We're now going to turn it over to Joanne Howard, who is the Director of Fiscal Reporting, to review the fiscal changes.
Good evening. As identified, I will be discussing the proposed fiscal changes to the waiver. The first change is related to a cost of living adjustment authorizing language change. And this is really a clarification to existing language. This clarifying language will allow the state to update the values for the fees and the personal resource accounts in accordance with legislatively mandated cost of living increases or any other form of reimbursement that is applicable to these services. And the reason that we are pursuing this clarification is so that we can make changes to fees, to personal resource accounts, and to other forms of reimbursement without needing to delay implementation pending the submission and approval of future waiver amendments. The second change involves rebasing. Periodically, OPWDD changes its waiver rates based on information from more recent cost reports submitted by our providers. As the current language identifies, rates are rebased within 4 years from the last rate update. This change will allow OPWDD to determine revised provider payment amounts within 5 years from the last rate update rather than the 4, which is in current language. This would be effective July 1st, 2024, and it is being added to the waiver language so that OPWDD can evaluate the potential impact of the COVID-19 pandemic on provider costs. The reference to this change is on page 344. The next change is related to self-direction tables and charts. Currently, the information regarding reimbursement levels for self-direction, fiscal intermediary, broker fees, and personal resource accounts are presented in a table in the waiver. What the change that is being requested will do is to allow OPWDD to present those fees in a table that will be available on the New York State Department of Health website. What we hope this will do is to facilitate updates to fees and rates on a more timely basis to reflect payment increases authorized in state law. Providers, the next change is with reference to penalties associated with the submittal of a cost report, which is identified as the consolidated fiscal report. All OPWDD providers are required to submit a cost report to OPWDD on an annual basis. If the provider does not submit a timely cost report, there are penalties associated with that late submission. The current language identifies a 2% penalty, and if the provider has an even later submission, a 50% penalty. The change that we are requesting is to eliminate the 50% penalty and to retain the 2% penalty. The next area that I will discuss, I want to be very clear, is an element in the waiver that will not change. We just present it for clarification purposes. Therapy days and leave days descriptions identify that changes that were contemplated to the waiver that have an effective date of October 1st, 2020 will remain in the waiver with that description. Because it does give OPWDD, and it has given OPWDD, the flexibility not to impose those changes because the language is on or after. The next change is with reference to administrative reimbursement. There is current language in the waiver to impose a 15% cap on administrative cost reimbursement. We have delayed the implementation of that cap, and we want to make very clear in the waiver that we are further delaying that cap and affording ourselves flexibility to implement the limit on or after 10/1/23. So what we're doing is utilizing the same on or after language that we had used with therapy days. With reference to the occupancy adjustment, the current language identifies an effective date for the elimination of the occupancy factor as October 1st, 2020. Again, we are trying to afford ourselves flexibility to delay the implementation of that adjustment as we have to date by putting language in that it is effective on or after October 1st, 2020. And the item there that is certainly the most pertinent is on or after. OPWDD providers received a number of bonuses over the last couple of years that were to be passed on to staff. You know them as the workforce stabilization bonuses or the ARPA bonuses. Correct reporting mandates that those bonuses be recorded in providers' financial statements and included on their consolidated fiscal report. What we are trying to clarify in the waiver is that even though those bonuses are reported on the consolidated fiscal report, and that is the correct reporting, they may be excluded for the purposes of calculating rates. So it may be excluded for rate setting purposes. So the exact language is effective on or after October 1st, 2023. Allowable operating costs may exclude workforce bonus payments authorized by state law and or otherwise approved by the federal government, including, but not limited to, funding related to the American Rescue Plan Act. And you will see the specific language on page 319 of the waiver. We had some flexibilities that were afforded to us through the submittal of Appendix K during the COVID emergency period. During that time, we made temporary enhancements to intensive behavioral services rates. Through this change to the waiver, we want to make those temporary rate enhancement changes permanent. And that is on page 362 of the document. And finally, the last of the fiscal changes we'll discuss tonight is with reference to two-fund transportation. Again, like the intensive behavioral services rate enhancement, this was a flexibility that is already included in Appendix K that we are bringing over to the waiver. Providers who operate site-based rehabilitation or pre-vocational services may have two-fund transportation, meaning transportation from the residence to the day program included in their reimbursement rate. Typically, the reimbursement is updated annually based on the most recent consolidated fiscal report or cost report. What this language will afford us is the ability to not make those enhancements until July 1st, 2024, when we have more appropriate information with reference to fund transportation reflected in those cost report documents. And you'll see references on page 277, 339, and 348.
Excellent. Thank you so much, Joanne. We're now going to review the quality and administrative changes, and we'll turn it over to Mary Ellen Mosier, who is the Division of Quality Improvement Deputy Director.
Good evening. My name is Mary Ellen Mosier. I'm Deputy Director of the Division of Quality Improvement. The quality changes in the waiver amendment are based on the lessons learned during COVID. This waiver amendment will implement a risk stratified methodology for conducting DQI on-site visits to certified sites. Under the new methodology, every residential and day habilitation site will have a complete site visit conducted on a routine basis. Sites in good standing with no deficiencies or limited deficiencies with approved corrective action plans will be subject to either a truncated on-site review or a remote review. Documentation reviews and possible webinar or phone conference call follow-up will also be included in this. On years that the complete visit is not conducted, truncated and remote reviews focus on site safety, fire safety, incident management, and high-risk hospital discharge events. This schedule will allow DQI to focus more frequent, full on-site visits where there is lower compliance occurring. Agencies that are designated as early alert agencies will receive more frequent DQI oversight until they are determined to be in full compliance and removed from the early alert designation. Any sites that are identified as life safety code sites will continue to be subject to annual on-site visits to ensure people living at these sites continue to be supported adequately to evacuate in an emergency. Life safety code sites are ones where the physical environment and/or needs of residents will require additional time for an evacuation in case of an emergency. These changes can be found on page 3 of the waiver amendment document, and there's references, minor references throughout the document to these changes. And now I'm going to turn it over to Anne-Marie Peterson.
Well, hello, everybody. I'm Anne-Marie Peterson, and I am the Associate Commissioner for Service Access, Program Implementation, and Stakeholder Support. And before I start on the administrative changes, I just want to make note that the reference for the DQI changes are on page 2 and the waiver versus page 3. But with the administrative changes that I'd like to talk about today, they have to do is they're noted in the waiver access section of the waiver, and they speak to people who are ready to be discharged from residential schools, institutions, developmental centers, or nursing homes. The changes here is to modify their need level to the highest need group so we can support them. And it's important to know with this change, there is not changes to others. For example, people living with their families who caregivers can no longer provide their care will also remain in the highest need group. These changes can be found on page 44. The other administrative changes has to do with language access, where we're updating to reflect the current rules around language access, and they can be found on page 58.
Excellent. Thank you, Anne-Marie. Additional minor technical updates exist in Appendix G, and they include the addition of the Promote curriculum as a replacement for SCIP-R, Strategies for Crisis Intervention and Prevention Revised. Promote can be taught in those agencies that have OPWDD approval to use this curriculum, and that can be found on pages 221 and 226. There are additional updates to medication administration on pages 231 and 232 in regards to the medication administration curriculum and certification. These include changes to the certification process and ability to transfer certification from one agency to another. As previously mentioned, this session is being recorded and will be available on the OPWDD website at opwddd.ny.gov/private/home-community-services-waiver. You can also contact us through the People First Waiver mailbox, which is peoplefirstwaiver@opwddd.ny.gov. Written comments will be accepted through May 12th. There will be a response to public comment drafted at the close of the public comment period. That will incorporate the feedback that we received in these sessions. We will now take a brief pause and reconvene to answer the questions that we have received. Thank you.
Thank you so much for your patience. Our first question is, can you explain the respite over 60 program?
Sure. So thanks very much for the question. I do want to start with, let's all remember that we are asking for CMS for permission to implement this, and we anticipate we will have that on October 1st. So there may be lots of operational details that we're working out in the meantime, and that isn't something that people should necessarily anticipate having on October 2nd. All that said, what we are looking to do in the waiver is to simply create another exception for people who live in a certified residence. Because right now, if you live in a certified residence, there's only very limited times when you can receive respite. And we want to add this as an option for people who live in residences. If you live at home and have a caregiver, you today can get a respite service. What we are hoping to promote is that it would be a respite service for folks who want to retire, whether they live at home with family or in a residence and they don't really want to participate in active habilitation services in day-hab, and they're looking for another option outside the residence for retirement-focused activities and socialization. So we're hoping to use the tools in the toolbox, which is a service that we already have, to create this option for folks. There'll be plenty more details to come as we work through, anticipating and hoping that we will have CMS approval to proceed. And then I think the next question really had to do with rate setting. And there was one question that had to do with where rates can be found for providers. You will note in the OPWDD amendment, we reference the mental hygiene rate setting page that's operated by DOH. That link is throughout the waiver. And you can also, of course, Google that. And provider rates, specific rates are posted there for public review. So anybody who is interested in that can go to that site and see that information. The other question I just want to address while I've grabbed the mic is that any questions or comments related to the waiver or to this presentation, we ask that you send those questions or comments to the People First mailbox. It'll help us make sure we're tracking and understanding the questions that folks have. So we appreciate your assistance with that. And then Sarah, I think the next question had to do with, and I'm going to pass it over to Joanne. There was a question about the impact of the CFR reporting changes where we are proposing to remove the higher tiered penalty for late submissions.
Yes, the concern was whether the removal of the penalties would have any impact on OPWDD's ability to gather information with reference to workforce stabilization funding on the part of providers. And it will not. I need everyone to understand that the number of providers that do not submit timely consolidated fiscal reports or CSR cost reports, whichever you want to call it, is extremely minimal and would not affect our ability to collect data.
Okay. Okay, we're going to pause for just a minute.
Thank you again for your patience. We just needed to regroup for a moment, and we are now ready to go.
Okay, hi, this is Kate Marley from Policy and Program Development. There was a question, a series of questions, I believe, on self-direction and the removal of the information from the waiver. As we discussed, what we are proposing and hoping CMS will approve is that the PRA tables and the fees for FIs and brokers will go on the DOH website that we had referenced earlier. And with that and the changes that we are making to the COLA language, we will be able to more rapidly adjust that table and the fees when there are COLAs or other adjustments that are made via New York state law. At this point, if we have them hard-coded, if you will, described in our waiver, and that means we're either out of compliance if we implement immediately, or we have to get a waiver amendment to be in compliance. So the solution is we put it on the website, we have the appropriate language in the waiver, and then we don't have to seek federal approval in advance of implementing what was provided via a New York state statute. So is there anything else that, Joanne, you want to add to that?
No, I think you've covered it, Kate.
Okay. And anything else, Don, in terms of the question? Does that cover it? Yes, one more time. Sorry for the delay. There was another question about whether people who self-direct and live in a residence can continue to use CHR, Community Hab Residential, in lieu of attending day habilitation, for example. Yes, nothing changes there. That is still an option for folks. If the person wants to do it in the residence, they will need to comply with the ADM governing Community Hab Residential. But as if it's outside the residence, that continues to be an option for everyone, no changes there. And then I think we had one other question from a gentleman who was looking to connect with a supported employment provider. The recommendation is that you contact your care manager. If you want to email that People First waiver box, we'll be happy to assist. So please feel free to drop us a line and we'll have someone reach out to you to help you with that. And with that, do we have any other sort of immediate questions? Okay. Well, I'd just like to take the time to thank you all very much for your participation this evening. It's been a pleasure to spend the time with you. We look forward to your comments, and we hope that this has been helpful in assisting your review. So thank you all very much.